Hey guys, so I just did my introductory video where I just introduced myself and kind of talked about my situation. So I'm going to actually make a video now about just specifically my story with the thyroid cancer and how I got diagnosed and what I'm going to be doing going forward with this, or my thoughts on what I'm going to be doing going forward with the thyroid cancer. So basically, my I'm not sure if I should tell the long story or the short story, but I'll try to keep it a happy medium. So back in January, I was just going about life. I'm in nursing school. I'm very busy. I have two little boys, 4 years old and 2 years old. At the time, they were 3 and 1, but so very busy. Nursing school is very difficult, but I was just in the midst of all the chaos and busy stuff. It was, Christmas just had gotten over, and my grandmother had a heart attack, and she lives in Florida, so it was just a really scary morning. My sister ran into my room and told me my grandmother had had a heart attack. And I'm very close with my grandmother. She was 78, and we didn't know she had any kind of health problems. So, thinking heart attacks, okay, they happen all the time. So anyway, I was actually going to school that day, and I was debating if I should fly down to Florida and leave my kids with family for a couple days to go be with her while she was going through this. So anyway, I decided at school that day that I was going to go fly down there. And so when I got out of school, my mom had called me and told me my grandmother was actually on life support already, and that we needed to get down there right away to see her before she passed away, basically. So we flew down there. On the way down there, I had obviously been crying hysterically and very upset. So on the flight down there, I was noticing I had some pain in my hip, not severe pain, but just like uncomfortableness, and I felt like a bulge in my hip. So we had gone to the hospital. We flew down there. We got down there. I saw her. It was very difficult. It was just one of the worst days of my life. And I had gotten back to her house once we had spent a lot of time with her in the hospital, and I noticed my hip was swelling, and I started feeling down there, and there was a big lump in my hip area. So I was really panicked. I also had like a burning sensation in my urethra, so I was afraid I had some kind of maybe an infection or a kidney infection or something that was affecting that whole area. So I had gone to the ER. I decided that night, I couldn't sleep, obviously. It was an awful day. And I decided to go back to the hospital where my grandmother was on life support to go to the ER there to get this lump checked out, because I was really uncomfortable. So they did all their tests. They told me I had a UTI and the lump was unrelated, and that, go to the OBGYN to get that checked out. So fast forward, my grandmother passed away within, I think, a day of me leaving, because I had to get back to my kids, and it was a really hard time. So in February, I finally had gotten the appointment to go to the OBGYN to get this lump checked out on my hip. And as I'm there talking to the OBGYN, he did a thyroid exam. So for the thyroid exam, they basically take your neck, they stand behind you, and they ask you to swallow a few times. And I guess, they palpate, they can feel the lumps if there's a nodule that's palpable. Sometimes they're so small you can't feel them. But anyway, I kind of knew about this because I'm in nursing school, so I knew about what this exam was. And, I'm not a professional or expert in any one field, but I just had, I kind of have an idea of what that was and everything. So anyway, after he did the exam, he told me, did you know you do have a thyroid nodule? So I was like, oh, it's weird, because I thought I had noticed the lump. And if, I don't know, sometimes I had been looking in the mirror like this, and I could kind of see this this area was more raised than the other side. So I had told him about that, but I thought I was just a hypochondriac because I'm in nursing school. Anyway, so he wanted me to go get it checked out. So I went to an endocrinologist, or was it? Maybe it was an ENT. I had gone to a doctor for them to do a biopsy of this. So I finally met with this doctor. I had to wait a little while to even get an appointment. I finally got in, and they wanted me to have the biopsy done. After they had run all my blood work on like my thyroid to see how it was functioning, everything was functioning fine. And I kept hearing like, okay, well, lots of people have nodules and they're no big deal. Usually they're non-cancerous, and you just go about your life and they keep an eye on them. So I really wasn't too concerned. Like, I had thought about it, but I was more still worried about this lump, which turns out they think it's just like a lipoma, which is like a fatty pocket of tissue, and they usually just cut it out and it's nothing. So it turns out that wasn't even something that like I needed to really be worried about. And this, I was just like, oh, okay, probably nothing. So your thyroid's actually located in your neck. That's why I keep pointing to my neck, if you didn't know. But so anyway, I got the biopsy done eventually, and I waited about 2 weeks. They told me it should take about a week, no more than 2 weeks, to get the results. So it had taken about 2 weeks, and I wasn't really stressed about it, so I wasn't like eagerly waiting by the phone to get the results. But finally I had gotten a call from the doctor's office, and they said that they wanted to discuss the results with me. And the whole time I'm sitting there thinking, okay, all right, well, just tell me everything's good and I'll keep going about my business. But the doctor I was talking to said that she had gotten the results, that basically there was a 70% chance based off of the DNA results that this was cancerous. So that with that information, they wanted to go forward and schedule for me to have my thyroid removed. So, I mean, when she told me that, I was like just so shocked because I wasn't expecting that. I wasn't even expecting that news. And then she's like, I'm so sorry, and telling me how sorry she is. And I think I just was like, couldn't process it. Like, and I was like, oh, I'm fine. It's okay. Everything's fine. Thank you for the results. And like, it was probably like strange. I don't know how often. I'm sure they get lots of funny results when they give people that kind of news, but I was just real friendly and like, okay, thank you, bye, I'll talk to you later. So I think it was just like, oh my gosh, like what just happened? Like, I can't believe that this, like, you hear the cancer word and it's just like, oh my God, like what am I gonna do? Like, you immediately go to, I'm dying, like what am I gonna do? Like, this is gonna kill me. But it's funny actually, because I know someone who had the same thing from my nursing program. There's a girl in my nursing program who, first semester, I was in a group with her to do a project, and she had told me, she's about the same age as me, she has a little boy, and we were doing something on thyroid, and she was like, yeah, actually, it's funny, I had thyroid cancer, and she had to have her partial half of her thyroid removed. So I know her, she's great, she's healthy, happy, and she always like kind of like chalked it up like it's no big deal. So anyway, I like knowing someone who has it, I kind of felt like, okay, well, like I shouldn't be this concerned because it's a good cancer, which realistically there's no good cancer, cancer's cancer, but it's not like the most aggressive type of cancer usually, unless it's like a specific medullary cancer, which mine's not medullary, it's papillary. I think it's just the difference in the cell type, but they already had tested it. It was not medullary. So anyway, they wanted me to meet with the surgeon to talk about the surgery, and I was kind of like, okay, like you're in shock that you got the news, but I was thinking, all right, well, let me go meet with them. I'll just get what I have to get done. So after talking with the surgeon, I just was starting to think like, or maybe this was before the surgeon, talking to the surgeon. I was starting to think, I really don't want to go through any kind of like invasive surgery or chemo or anything like that. I'm so young and I work in the hospital, so I see how sick people are when they're on chemotherapy and radiation, and I really don't want to put my body through all that. So I was contemplating, like, immediately, okay, should I do an all natural, like, remedy for cancer? And I know a lot of people might be offended by that because people go really crazy when you talk about natural cures, because it's not talked about in the medical community. And even with me becoming a nurse, I still can see how Western medicine totally, I mean, I think they're slowly starting to have to adopt some practices or understanding that people want to try those options, because people are starting to explore those options. And we live in a healthcare setting now where it's consumer driven, so they have to please people, and if they're not pleasing people who want to try all natural things, they're going to be losing customers. So that's the mindset, and I think that's really the only reason that most Western medicine physicians or whatever practitioners are willing to contemplate like natural alternatives. But realistically, at the end of the day, they're not going to want you to do any kind of natural alternative. So anyway, after that tangent, I did think, like, okay, let me try to go vegan, because in my time that I've been doing nursing classes, I've heard quite a few times just people mention, like my professors, like every once in a while someone will say, like, oh yeah, I heard if you go vegan, it's cure people of cancer, blah, blah, blah. So I was like, all right, that's it. I'm going vegan. I'm not, like, if there's something I can do to stop myself from dying young and not being around to see my children grow up, like, I'm going to do it. I don't care. So I was like kind of starting to research like what, people who've cured their cancers naturally. And it has happened. No matter what anyone tells you, I mean, the doctors are going to tell you it's impossible, but there's people who have done it, including Suzanne Summers. She did have some treatments, but she largely did everything naturally. So I, for a long time, was like, or at least a whole week, I was actually totally vegan for a week because I was just so scared and in such shock. And then I met with a surgeon, and actually it's funny because the girl in my class had recommended this particular surgeon that this endocrinologist referred me to. So I met with her. She was great. She was so nice, like the nicest doctor I have ever met. I've met a lot of doctors, and she had the best people skills. She was so compassionate, so understanding, and she even listened to me. Like I didn't tell her fully like I want to do things naturally, because I still wanted to hear her side. I didn't want her to think I was crazy, because I think a lot of times they will chalk you up to being like, oh, she's like, but I think she was a little younger. I think she was understanding of my perspective, but she basically said, I told her one of my main concerns was I don't want to be relying on medication for the rest of my life. So she said that if they only remove the one half, which, looking at my thyroid, she said that they think that I would only have to have the half removed, that I could get away without having to be on medication if my other side of my thyroid picks up the function for the side that was removed. And she said, and then the other thing for me, the other big concern was I want to be able to have children in the future. And she said I would be able to have children, no problem, especially if I only had the one half removed. So that really just made me feel so comfortable. I felt like, okay, like she really listened to my concerns. She understands where I'm coming from. And on top of it, like, my concerns were like dealt with. Like, I feel like, okay, like this wouldn't be the worst case scenario if I had to have it removed. Now, if they told me, I want you to do chemo or have radioactive iodine therapy, I don't know that I would necessarily want to do those things, because they're toxic. Those things are toxic to your body. There's no questioning that. So I don't want to put something that's more toxic back into my body, even if it's like supposed to be treating the cancer. Like, I'm not going to kill myself to try to cure myself. So if it came to that, I would definitely do a 100% all natural therapy and just go balls to the walls natural. But unfortunately, I kind of slipped back, like, since they told me, like, oh, everything's going to be fine, like if you got the one half removed. So I kind of have been slipping back into my old eating habits, which I'm still going to try to change anyway, especially if I get the one half of my thyroid removed, because it's going to probably put me into like a little bit hypothyroid, most likely. Um, so anyway, I'm going to change the way I eat. I will. I'm going to do it. It's just, life gets crazy. So that's the main story right now. So after meeting with the surgeon, I've been kind of struggling, like, okay, well, they wanted me to have an ultrasound of my lymph nodes, to see if the cancer had spread to the lymph nodes. And if that was the case, if it did spread, then they want to remove the whole thing. And then I have a funny feeling they would probably want to do chemo and radioactive iodine and all that stuff. So that's where I'm kind of like, okay, if it gets to that, I don't know if I want to go ahead and have the whole thing removed, because now I'm definitely reliant on medication for the rest of my life. I have no functioning thyroid. And I just don't know how I feel about that. It's really concerning for me. So I'm still waiting actually on the results of the ultrasound. I had it last week, and I'm waiting for a call from my doctors about the results. So, and I was just checking my phone to see if they had called me, actually, because I called them today to follow up on it. So depending on how that goes, I'm going to go ahead and schedule the surgery, because one of the other reasons I'm choosing to go forward with the surgery, most likely, rather than doing it all naturally, is because I actually watched a story of a woman on Chris cured cancer or something. It's this kid who like naturally cured his cancer, which I have like all the respect for in the world. I think that that's totally amazing, and I would 100% jump on board with that if I knew that we were going to be doing like chemo or anything like that. But anyway, this girl was doing her thyroid cancer. She was trying to get rid of it herself, and she did for the longest time. And basically, she ended up getting pregnant, which is what she had wanted. And that's why she didn't want to have her thyroid removed. She wanted to be able to carry a pregnancy in the future. So she did it naturally. The nodule was going away completely. But then when she got pregnant again, it came back rapidly, and I guess it cut off her airway, and she had to have it removed anyway. So my thought is, okay, if these cells aren't going to 100% go away just by me doing something naturally, I might as well just get it out of my body, get it taken care of, and then start from square one, going vegan or whatever, and doing natural things going forward. So that's my reason, because I'm trying to decide between the best of, I guess both possibilities. So that's my story, and I will keep you guys updated on what happens going forward. I'm just waiting on the results of the ultrasound, so I'll post about that once I get them. All right, and feel free to ask any questions, or if there's anything I didn't explain clearly or anything, just let me know. And if there is anyone who's going through the same thing out there, I know what you're going through. It's so scary, but thankfully, they say thyroid cancer is easily treated. I hope mine's not one of the few that's like the crazy, I don't know. I hate to think worst case scenario, and I've been trying to think the best, and then I just keep getting news. So anyway, stay strong and keep fighting. All right, guys.